Hi, I'm Jessica Donmoyer. I'm Lucy's mom.
Hi, I'm Lucy, and I'm the big sister of Charlotte Grace.
And I'm Lucy and Charlotte's dad, Jordan Donmoyer.
So with Lucy being diagnosed in the beginning of a pandemic with her treatment plan being about 18 months, we got adjusted real fast. Immediately it was going to Nemours weekly for labs, and she met a wonderful, fantastic nurse, Tori, who has helped Lucy every step of the way, and I would say equally helped me, being Lucy's primary caregiver at the time in the hospital because there's only one of us allowed. And then the doctors at Nemours have been phenomenal. Dr. Banzel is Lucy's primary oncologist. Every step of the way, she has kind of advised me, don't worry about this or that, just worry about what's in front of you, and really taking that to heart of one day at a time, one treatment at a time, one cycle at a time. So I can't say enough about Nemours in that regard of hiring such amazing medical staff. And those are just an example of two people. All of the doctors and nurses have been amazing.
Here at Nemours, when we provide care for a new family, we are here to provide comprehensive care because we're here not to just give their medical treatment, their chemotherapy, which is what we most often do, but we have a multidisciplinary team. We provide surgery, we have radiation therapy, and almost all cases when we start, our goal is curative treatment. And we help families get through that. Sometimes treatment is as short as a surgical procedure, but we have others who go through initial therapy that can last up to 2.5 years.
So we found out about PedsCare after Lucy relapsed this past February in 2022. PedsCare for us means palliative care at a time when, Lucy can't do a lot of things and we need a lot more help. But then, we learned that there's so much more to that, and it's, having a social worker that helps with us and helps, get us to other events and do more things, but also a child life specialist that comes and helps work with our family at home. And that's huge because it is hard to do that only when we're in the hospital.
So I first met Lucy after she had relapsed, and so Lucy had already had a lot of experience, unfortunately, with oncology and with her diagnosis and her coping about her diagnosis. Part of what I help to reinforce is just the normalization in it all, medical play, exposing her younger sister, Charlotte, to those things because she was not present as many doctor's appointments or hospitalizations due to COVID, and because she is younger. So helping her to try to understand why it is that Mom and Lucy are going away for a few nights again at the hospital, and helping her with that separation anxiety.
As a psychosocial specialist for Lucy and her family, I help to connect them with other families through our Facebook page and also through our community events. In addition, I support the family through assisting in identifying coping strategies and validating care and providing reflective and therapeutic listening.
The old saying, it takes a village, really is our goal. It takes a village when you have a family impacted with a disease, an illness, a process that's new to them. It really does take a village. And so what is important to us is that we are working in our very tight partnerships on behalf of the families in our community. And one of our extraordinary partners is the oncology group with Nemours Children's Health. And this group and Community PedsCare together can surround a family fully with care, not missing a beat, providing continuity from a hospital setting to a home setting. We all work close together because our one common goal is that family, and that's what a true partnership is. It's about the family, and the family being first and front and center.
Over the time that I've been here, we've seen some remarkable advances in pediatric cancer care. What I'm most proud of is that over this 20 years, We've seen steady and consistent improvement in outcomes and survival for our patients, but we've been able to do it all with fewer toxicities, meaning fewer short-term side effects during treatment, and also fewer late effects as we move forward and see kids develop into their older years.